So here's my audience, all three of them. Okay. I'd like you all to take a moment to look about the room. Notice very carefully what you can see. Now close your eyes. Imagine a world without vision. A world where everything is blurry, where you can't make out the large block letters on a billboard, where you can't distinguish the details on a loved one's face. A world that's even worse, a world that is dark. This world is a reality for many with a retinal disease. But what is a retinal disease? What is the retina? The retina is the nerve layer of fibers on the back of the eye, and it is the tissue responsible for sending nerve impulses to the brain via the optic nerve. A lot of medical jargon later, the eye is basically like a camera. The lens at the front would be analogous to the lens of a camera and is what focuses light onto the retina. It is this that allows for a clear picture to be seen. While glasses help correct vision deficiencies in the lens, the best camera lens in the world isn't going to make any difference if the film is damaged. Such is the same with the retina. But hope isn't lost if one is diagnosed with a retinal disease. Just because glasses can't correct vision loss due to the retina doesn't mean other treatment options are not available. But as with any medical treatment, treatment is dependent upon the diagnosis. While there are many, many, many retinal diseases and disorders, there are a few, having worked in a retinal clinic, that are very common. These would include exudative macular degeneration, otherwise known as wet AMD, diabetic retinopathy, and vein occlusions. The main form of treatment for these diagnoses is injections of medication into the eye. There are several medications that can be injected into the eye, ranging from steroids to antibiotics. Within a retinal clinic, there is one common type of medication that is often used. This would be antivascular endothelial growth factor, or anti-VEGF, of which there are three types: Avastin, Eylea, and Lucentis. In order to understand the mechanics of an anti-VEGF medication, one must first understand the diagnosis itself. What these three diagnoses have in common is they are all primarily diseases of the retina, affecting the blood vessels. They either lead to broken or blocked blood vessels that leak fluid into the retina tissue, causing swelling, and it's this swelling that causes poor vision. Or they result in broken blood vessels that leak blood into the vitreous fluid, causing a hemorrhage, once again, causing a decrease of vision. What the anti-VEGF medication does is fix the broken blood vessels and stop the swelling from occurring, improving the overall vision of the patient. Unfortunately, one injection itself is not enough to fix the disease. Patients often have to receive injections of medication every 4 to 6 weeks for a duration of time. Patients often are then able to extend their treatment interval up to 3 months, meaning they receive about 4 injections over the course of a year. Some patients are even able to discontinue treatment altogether. Many people recoil at the thought of receiving an injection in the eye. People don't like shots, period, and the idea of one in the eye is terrifying. But the treatment isn't nearly as bad as it seems. The process of receiving an injection in the eye is very streamlined and effective. Patients do not see the needle, nor do they feel the injection itself. Many patients express disbelief after their first injection. They cannot believe that it's already over. What's more is the incentive to get treatment. All of these diseases are degenerative, meaning that they get worse over time. So without treatment, your vision will just get worse and worse and worse. Once again, close your eyes. Imagine a world where you can't even see fingers in front of your face. Barely able to discern movement. You are unable to do things like read, drive, watch television, or even navigate in an unfamiliar environment. Gone are all thoughts of independence. But all of this can all be corrected with a simple and painless injection in the eye. Makes a lot more sense when you picture it that way, why people get these treatments. But what does all this mean for you? It means that you should see an eye doctor on a yearly basis to get a dilated exam, because early prevention and treatment is key to keeping you seeing the world as it's meant to be seen. Because after all, and who knows, maybe you just need glasses. It's better safe to be sorry. It's better safe than sorry. Because a world without vision is a dark one